You have you been struck by unexpected injuries? Well, stay tuned. Don't let it sideline your passion of archery. So it's time to turn those setbacks into comebacks. So let's navigate through the road of recovering together and get you back on target. Welcome to Archery Talk 101. I'm your host, Roy Canterbury. In today's episode, we're focusing on the crucial aspects of archery, staying injury free. We'll cover the common injuries archers face and how to treat them, and most importantly, how to prevent them. Now, please note that while I'm an experienced archery coach, I'm not a medical doctor. The information provided in this discussion is based on common practices and knowledge within the sport of archery. For medical advice, diagnosis, or treatment, always consult a qualified healthcare provider. Stay safe and shoot straight. Now, I've got about 35 different sources that I reference to come up with this. I'm just going to summarize it. I'm not going to go in detail in all of them. I'll leave a link to the articles that I've used to reference this at the end. So if you want to take a look at it a little bit more, feel free to look into that topics individually. So before we dive into today's topic, remember that you can watch this podcast live in Arch Talk 101 Facebook group. So those that are in the group, they can make comments. Replays are also available in the Arch Talk 101 Facebook group and on my YouTube channel, Learn to Fix It Yourself. They're also available on archtalk101.com. And for those that prefer to listen to audio while you're driving or whatever, you can listen to it on Spotify and audible.com. So that's a couple places you can listen to it. And with that, let's get started. Let's start with shoulder injuries. These are often caused by overuse and improper form. We have talked about this in the past a little bit on some of that. The improper form can lead to conditions like rotator cuff tears, where you're having that arm up instead of having an arm relaxed down, you got that shoulder pushed up. You see a lot of archers, you'll see them that shoulder be pushed up. Well, what's happening in that is it's not lining it up very well. We'll get in a little more detail in that a little bit later. To prevent the injuries, it's essential to practice the proper technique. We've talked about that in some of the last ones. Engage, in conditioning exercises, to build your shoulder strength. There's things that you can do to build them up. If you know a sports medicine doctor or some, an athletic trainer, one that knows archery, they can help you with certain techniques that you can do to help that. So let's start, let's get into this. Let's understand the injury that is going on. Mechanics of shoulder injuries in archery. We'll talk about that here a little in just a second here. Shoulder injuries in archery typically stem from the rotator cuff. A complex system, muscles and tendons that stabilize the shoulder. These injuries can manifest in tendonitis, bursitis, or even tears. They can occur every time you draw your bow. So you better make sure that you have that, proper. Now, how you're in proper form can cause your injuries. One of the things, jerky draw motions. When you use a jerky motion to draw your bow, it places sudden and excessive strain on the shoulder. So you go out and all of a sudden you just really just slam it back as hard as you can, as quick as you can. Maybe you're drawing too much weight. The only way to get it going is just get that momentum going. That you want to avoid that. That can cause problems. Poor arm position, incorrect arm position, such as having the elbow too high or too low, can lead to imbalance in the muscles, causing overstrain in the shoulder. So you get that elbow, up and you turn that elbow way up, or way down, and it just doesn't put it in the good position. If you use that proper grip or the hand position on that riser into your hand contact, it's going to put that elbow in a good position. Make sure you drop in that shoulder. Overexertion is another thing that we want to, address here a little bit. Continuously drawing the bow without proper back muscle engagement, can exhaust your shoulder muscles, leading to poor form and increase your injury risk. You know, go out there, use those back muscles to draw. Don't use your shoulder and your arms. Those are the weak part. Use that back muscle because rather than trying to pull across your chest, use your back muscle. It's going to do the same thing. It's going to be much easier and they're much stronger. Um, using a bow with a pull weight that's too heavy, you know, the archers using that, it can force the shoulder to compensate, for increase, that's going to increase the likelihood of an injury. Too much weight, you're not going to be able to relax that shoulder. You know, let's talk a little imagination here. Imagine an archer at full draw. The ideal form would have them engaging their back muscles, maintaining that straight line from the arrow through the draw arm, to the shoulders. However, if an archer relies solely on the shoulder to draw and hold the bow, the rotator cuff is unduly stressed. You know, this, this important form, this is important, so especially when repeated over time, that can lead to inflammation in the shoulders and even cause tears and shoulders. So make sure you're having that relaxed. Have somebody watch and see as you're drawing, does that shoulder pop up? That's something that you want to watch for. As you get older, it's a little bit harder. So now, once you've done that, let's see. Okay, how to recover from it? Well, um, rest. The first most critical part, for the injury is you need to take a break from archery, allow the inflammation to subside and the soreness to go away. And then when you come back, you're going to be better. Just learn the correct form that and eliminate the form that caused that shoulder problem. Now, ice, applying ice to the affected area can help reduce swelling. Ice is going to help relieve the pain. It's going to reduce the swelling. You want to use heat to loosen it up, but heat to, recover from it. Then there's, pain relief. If you have some, like ibuprofen, and Tylenol and those, just make sure that what you're doing, you're not overdoing it and don't keep taking, more than you have to. Um, make sure that if there's something that you can't tolerate, that so there's aspirin, there's ibuprofen, there's Advil, there's all kinds of different ones. So the best way to do it is use one of those. I would avoid any hard drugs, for pain relief, like your oxycodones and stuff like that. That has a whole bunch of other problems in it. All you want, ibuprofen good for reducing swelling in there and relieve some of the discomfort. If you can tolerate ibuprofen, don't keep taking it for a long period of time because it can mess up, other organs in you. Um, Now, medical advice is always recommended. Get to a professional. Let the that's essential part of getting diagnosed properly. You might think, okay, it's just sore, but maybe you got a tear. So the doctor will be able to diagnose exactly what the problem was that with it is, and especially if you go into a doctor that deals with athletes, um, they're going to have different responses than one that's just a normal doctor because they're going to say, well, don't use it. Well, that's as an archer, it's like, okay, that's not the answer I'm looking for. I want to still be doing it. What can I do so I can still go through working it out? So maybe what you do is, maybe, a physical therapist will have ways that you can still keep your strength up a little bit and not provide, that strain on whatever your shoulder problem is. Maybe you're just working through a real light, bands that just keep going through the motion, so, but that's where, the doctor and the physical therapist, those all, come into play in figuring out what your path is forward. Then there's rehab exercises that you can do. Here's some of the things that I found some of the research I did. Rotator cuff strengthening exercise. That targets the rotated cuff. And that's vital for recovery. These might include, internal and external rotation with resistance bands. Just keep them loose and keep them going through. Then there's scapular stabilization, which is strengthening the muscles around the shoulder blade. Can help help the rotator cuff prevent future injuries. Um, and I have articles that, you can refer to get a little better or get to a good doctor. Um, Flexibility, incorporate stretches to maintain that proper range of motion. Go through some exercise where you're rotating your shoulders, so that it can keep it loosened up and you can see where the stiff parts are, and you can work through that. Maybe there's different exercises you can do, to work through and keep those flexible. Um, Now, here's the part that we want to know. How do we return back to archery? This is going to be a gradual thing. If you've had a major injury, now if it's just sore, sometimes you could just ice it, take a couple ibuprofen, let it relax for a few days, and then go. Other ones, you might take you longer. So what you might have to do is you might have to modify your practice. Um, when you're off for a while, when you start shooting again, you're going to have to work up slowly. Consider shorter sessions, with the perfect form, and avoiding strain, so don't go out there. If you're used to shooting 300 arrows at a time, when you start back, you're not going to shoot 300 arrows, so maybe you go out and you shoot 5 arrows today, and then you go along until that's not causing a problem, and then maybe go to 2 rounds, 2 rounds of 5, and then shoot 5 at a time or 3 at a time, whatever target you're shooting at. You're shooting a 3 spot, shoot 3, and then go pull them and come back and then rest, and if you start getting to where it's starting to hurt, you don't want to have pain. You should feel a little stress on it, but once it starts in the pain, now you've kind of turned back. You may need to adjust your equipment, the draw weight. You may need to crank it down to the minimum to start with. After, you're using this for conditioning, not really trying to see how much draw weight you can have. You know, so lower that draw weight, during recovery process. Then you can always start gradually. Once you get back where you can shoot all the arrows that you were before, now then slowly start cranking the weight up if you want to shoot that higher weight. Now you may keep it down low because that higher weight might have been what caused your problem to start with. So you may have to, if you're used to shooting at 7, you may have to go down to 60. As we get older, that's something that, we may have to start adjusting. We can't always shoot 70 as we're getting into our 60s and 70s. We're in our 30s and 40s, 70 was nothing. Well, that gets a little harder. So you need to take that into adjustment too. It's like where you're going to recover to. Now let's go in a little bit of subject on how to prevent injuries. After all, that's where we want to be to start with. You want to keep ongoing conditioning, even after recovery. If you haven't had an injury or if you haven't had one, continue shoulder exercises, to keep the muscles flexible and strong. And then form check, you want to regularly check your form, with a coach to ensure that you're not falling back to habits that could have caused the injury. So, one of the things you can do is take a video of you shooting, upload the raw video to Arch Talk 101 Facebook group and say, hey, take a look at my form and let me know what you think. And we'll take a look at it. I've looked at many videos, and you can play them back and stop them, pause them. If I needed to, I can upload it to my video editing software, and I can go frame at a time. So I can, just hit the arrow key and go frame at a time. It's like see what's going on in slow motion, basically. So we can take a look at it and see what is going on with your form to help you prevent, that shoulder injury. Now, some little bit of closing thoughts on, shoulder injury. Recovering from a shoulder injury, it's a journey that requires patience and dedication. Follow these steps that I've talked about and work closely with medical professionals. You can return to archery stronger and more resilient. So that's just something that we want to take a look at. If you have a shoulder injury or even preventing it, let's prevent it. Let's work on your forms and not have that problem if we can avoid it. Now, the next injury I want to talk about is tendonitis. I'm going to do a little bit of description of what it is. You may not know. Tendonitis is commonly known as archer's elbow. Tennis players get it, tennis elbow. It's an inflammation. condition, that affects the tendons. That's where your robust fibrous tissue connecting the muscles to the bone. Um, that's what your tendons are. In archery, this condition frequently manifests in the elbow due to the repetitive nature of drawing and releasing the bow. Now, me, that's going to be mostly the bow holding it, because you can have the drawing elbow can be sore. There was one time when I could not carry anything in my right hand. I shoot right-handed, and I had my my wrist strap on, and if it done correctly, but I could draw my bow at 70 pounds, but I couldn't carry 10 pounds in that right hand. That's because of where the pressure goes. If your release is on your wrist like it's supposed to be, we've talked about this several times, you can draw back and the pressure's not in the elbow. Now, if you're pulling back on your hand, now then your pressure starts going into your elbow. So using a handheld, you're probably going to have a little bit more pressure in the elbow. So if you're having a problem with your drawing elbow, have your wrist strap, make sure it's on your wrist, not onto your hand. So if you put where the wrist is, if your wrist, you can bend your hand up and down, and that wrist isn't moving, or the release isn't moving, it's in proper place. So if you look at your hand, you go down, it gets smaller, and then there's a little end of the bone, the forearm bone has a little knob on the end of it. You want your release above there, and that's going to give you that best one to eliminate tendonitis in the drawing hand. Now, we're going to cover over some biomechanical causes. That's kind of a long word, but well, we'll kind of break it down. Um, you know, Micro trauma to tendons is basically what we're going to talk about here. Each time an archer draws the bow, the elbow tendons experience a micro traumatic event. Over time, these small traumatic traumas can accumulate, leading to microscopic tears within the tendons, and fibers. So, um, you know, that's something, that proper form is going to help you out with that. Now, the other cause is overuse. Repetitive motions of drawing the bow, especially with improper form or excessive practice, continues to stress the tendons, it's suppressing their ability to recover and remodel. Um, you know, that leads into inflammation. Um, I know there's one time I was in what they call it 10,000 push-ups. So you're going to do all these push-ups, in a month. You want you to do 10,000. Well, I was going through everything, I did everything building up, building up, building up. By the time I got done that month, my elbows just wouldn't take it anymore. So that was that overuse because I didn't build up gradually. I was trying to do this challenge at 10,000 push-ups in a month. I did it, but I kind of paid for it, in the pain in my elbows. So you have to kind of stop and then recover, and that's one things you don't want to do too much too quick. You want to push yourself. If you're shooting 60 arrows, and that's you always shoot 6 arrows, you never shoot any more than 60 arrows. Well, and you get at the end you're getting a little more tired because that's what you're used to. Well, in order to be able to shoot 60 arrows comfortably, you might need to shoot 100 arrows, so that by the time you get to 100, now you're starting to get tired. But don't start off shooting 100 arrows. Start off with shooting, whatever you can comfortably shoot, and then just, after, every week or so, and increase it by say 5. You start off and you're struggling to get your form down. You shoot 5 arrows, and you're now your form, you can feel your form not working right. You might need to go back to some of the techniques we talked about earlier of shooting with your eyes closed, to make sure that form is there. If that form goes away, then you want to make sure you take that. One of the things you can do is when you start your practice off, take 3 or 4 shots with your eyes closed, and it's like, okay, form feels good, and then shoot your practice. That's just one of the things. Overuse it's easy to do, and those of us that are athletes, and we want to push and push and push and push, and then when we think we're tired, we're going to push some more. That's good to a point, but as we get older, yeah, that don't work too well. And there again, we're going to talk about improper technique. That's kind of a theme along here. You notice improper technique is going to can cause problems. So, um, drawing the bow with incorrect arm or wrist position, that alters the load distributed, across the tendons, which causes excessive strain on those tendons. Now, let's talk about some physical responses to the problems we've talked about. One is inflammation. In response to the micro traumas, the body initiates an inflammatory process. It basically swells up, which is characterized by pain, swelling, and reduced range of motion. And you as it inflames, then now it's getting tight. I have a problem with my one knee that's constantly giving me a problem because I didn't realize at one time it was swollen up a little bit. And I was in my martial arts class, and I knelt down, and all of a sudden, that swelling forced that knee joint away from where it's supposed to be, and I've had problem with it ever since because I popped it out, so I weakened the tendon. So that's something you have to deal with is if your body is swollen up, you need to make sure you alter what you're doing. And then there's degenerative changes. Chronic tendonitis can lead to degenerative changes, within a tendon structure, that compromises its strength and elasticity. And, and that increases the risk of injury. So that's something that you want to look at too. As we get older, we need to look at what is changing in our body. Now, how do you recover from it? Well, basically the same as the rest of them, rest, that's the cornerstone of recovery is rest. That's gonna be the whole thing, allow that inflammation and tendons to heal. You know, this may involve not practicing archery in a while, for a while. Ice, just like before, apply it to the affected area that reduces inflammation. Um, like we talked about, ibuprofen, Aleve, all those different things, over the counter stuff. Just make sure you don't abuse them too much. Um, Now there is medication that you can use, non-steroid anti-inflammatory drugs. Um, those you could take, that's like an ibuprofen. That can be used to manage pain and inflammation during acute phase. So, ibuprofen is good for the inflammation. So that would probably be, well, that is my first choice. And then, maybe some Tylenol or something. And then, of course, you can go to physical therapy. The physical therapist can tailor a routine for you to go to rehab from that. Focuses on the strengthening in the forearm muscles, and improve the tendon resiliency. And now then, what we really want to know is how to prevent them. So that is going to be the thing. How do we prevent that tendonitis? Well, warm up is one, engaging in a thorough warm up, your routine, before you practice, that can, prepare the tendons for, demands of archery. Just grab it the first thing up and grab it and pull it back, that you might need to warm up a little bit, move around or whatever you need to do, go through that range of motion, go through, do some stretching, so whatever you want to do to help loosen up the muscles, and you'll find what works best for you. And you can always talk to a coach or a physical therapist to give you ideas on that. And of course, you could always Google ideas and look on YouTube, and just remember that they're telling you what they want to tell you, not necessarily the best for you. So when you do find some stuff, see if it's something that's going to work for you. you know, Working with a coach, that's important. They can refine that shooting technique, to ensure, that you're not unduly stressing those tendons. And then again, maybe adjust the equipment, using a bow with a proper draw weight, that can put stress on it. If it's too long of a draw length, that arm is stretched out, and you don't have all that straightens that elbow out, so it doesn't have any place to go. The shoulder is raised up when your arm's stretched all the way out. That proper technique is going to drop that shoulder down, relax that elbow, so you're not putting strain on it. Now, if you have some physical reason why you can't have your arm bent, um, then get with the coach, because we can work through other techniques you can use to have them. I know I worked with a guy with MS, and if he had his arm bent, he would shake so much. So we did it. So we locked it. We figured out how we could get it so he could lock that arm out so he could at least be steady. So there's things that we can do to help out in those. If you can't get your head in that proper position because your wrist just doesn't bend that way. You've had an injury. It can't, well, then we can work with that to see how can we get that hand and technique that's going to provide the rest of your arm to line up correctly. you know, One of the things you want to do, understand, these kind of details, on the tendonitis, how it develops and addressing, the contributing factors. You know, Archers can effectively manage and prevent this common condition. It's crucial to listen to your body and respond appropriately to the signs, or pains or discomfort. Now, we're going to talk about something that's not quite as normal as you would think. We're going to talk about string slap. Now, that's different from your string hitting your forearm. If you hit your forearm, that's going to cause a big problem, and that is caused majority of the time by too long of a draw length and improper grip on the bow because you're gripping it like a baseball bat instead of like a bow. So that puts that arm in the way. Now, string slap is something a little bit different because that is generally, if you wear a watch, between the watch and your wrist is where it's going to slap it. I don't know if you can see, but right in, those that are watching, you can see, right in here is where I get the string slap. Now, what that is, because I don't hang on to the bow, and as the bow jumps forward, because I have an older bow, it's going to jump forward. And what that is when that bow is jumping forward, it's catching a little bit of that arm because that's kind of where it's at. That's past the where the bow normally sits. So one of the things you can do is the incorrect grip, where you're gripping too tightly or in proper alignment. That's what it's talking about here, is that puts that arm in the way of the bow. So you want to look at that. Improperly rotating your elbow. So you got that, and you got your elbow outwards. You leave the inner forearm, vulnerable to being struck. So you just want to make sure that you have that proper, uh, you know, form. A long draw length. That's the one thing we talked about. The long draw length that puts that arm in the way. A real low brace height bow. Those that have real low brace height is more likely to catch your arm or your up there on your wrist, up above where your watch normally would go, because the string, as the string leaves the bow, where it's at rest. When the bow leaves, that string actually goes forward some until the arrow pops off, and then it comes back and it vibrates back and forth. So we see it in slow motion. It does quite a bit of vibrating back and forth. That's why we put the string dampeners on it, because that vibration is like you pluck a string on a guitar. It's going to make noise. So put dampeners on, which dampens that vibration. So that's just a little bit more of a tidbit information. Shooting a closed stance, which is what I teach, you're going to get more because that arm is out straight. You're going to get a little bit of a string slap on that. Now, when mine hits my wrist, I look, it's like, oh, it's red. I don't even notice it because it doesn't really hit it hard. You can see after I shoot for quite a few, you can see a little red starting to form. No real pain with it. But if you do hit them really hard, here's some recovery tips. You want to, as quick as you can, you want to remember the RICE, which is rest, ice, compression, and elevation. So if you do get a big urge where you're swelling up and everything on there, you want to stop shooting. You don't want to keep hitting anymore. I've seen archers that hit that and that part of that forearm up there, and it just swells up. And then they shoot again, and they hit it again, and they shoot it again, and they hit it again. Every time you hit it, you're going to cause more and more damage. So, if you hit it, it probably told you you're doing something wrong. So fix what you're doing wrong, because you should never be hitting your arm. Now, if you're shooting a recurve or a longbow, those are a little bit harder because you have to hang on to them a little bit, or even wrap your index finger and thumb, touch your index finger to your thumb just so you can hold it. They're not, quite as easy. That's why I use arm guards on there. Put that arm guard on. If you're shooting one of those that you hit in your arm like that, put an arm guard on there. And of course, ice. That just remember rest, ice, compression, elevation. So you want to rest it, you want to ice it, keeps swelling down, keeps pain down. Compression. You use a compression bandage for swelling. If it swells up, as soon as you can, wrap it and keep that pressure down. Um, I know this works really well. When I was doing martial arts, we would get all of a sudden, with somebody, you or somebody else would bang up their shin, and all of a sudden it would just swell up. So the first thing we'd do is we'd take, it's kind of hard to do it yourself because you inflict a little bit of pain, but you'd take your hand and you'd push down on where it swelled up. You'd push down and you'd hold it and hold it and hold it. You put a lot of pressure on it. And then next thing you know, when you take it away, the swelling's gone. You heal in just a matter of a day or two. Where if you left it, you're going to have healing time of a week or better. So that's something we learn, going in martial arts. We're always banging up stuff. When you're sparring and your shin hits their shin, your shin shows up. We take care of it. Same thing on anything else. You want to compress it and then hold it, and then once it does it, now what the body does, it goes through time, it swells up, and then it heals and shrinks back down. So what you've done is you've eliminated time for it swelling up and the swelling to go back down. You've eliminated all that time, and now it can go to the healing part because now the swelling's gone down. And then, of course, the other thing is elevation and keep it elevated. So whatever it is, keep it elevated above your heart anyway. You don't have to necessarily be above your head, but at least above your heart, and that helps keep the blood from flowing down into it. It's flowing away from it. Or if it's in a leg injury, lay down, put your leg up or something. If you're home, lay on the floor, put your foot up on the couch, something like that. you know, then after that initial treatment where it's healed, now you want to put heat on it. That helps boost the circulation and relieve the pain. You know, there, stuff like aloe vera, that may help you putting on top of it, and other things to help in the healing. There are some other stuff that, I have that, I'll go through and I'll put on there for help for healing. There's some essential oils that you can use. You have to do your own research on that, what would work good for what you're doing, because depending on what's going on is how you prepare it and whatnot. So there's sources for that. You can just Google, essential oils and find a place to use it. I go get mine from a place called doTERRA. Um, Not that, where you get it from doesn't matter. Just make sure you get some good quality stuff. Now, from let's take a look at, from a coach's viewpoint, on preventing that string slap. You don't want to relax your grip. You know, you want to maintain a firm yet relaxed grip, with your knuckles, 45-degree angle to the riser. That is going to get that angle going through between the index and the thumb down to between the two meaty parts between your little finger and your thumb. Um, make sure that elbow gets rotated properly. And if you have a slight bend in your arm, you have that grip that's going to put that elbow in the right place. Um, you want to make sure that your equipment is set up correctly, the appropriate draw length and brace height. The brace height can change things. And if you have too short of a brace height, that you're not going to change too much on brace height unless you're shooting recurves or longbows, because shorter strings, longer strings is going to change that brace height. Well, on a compound bow, you're really not going to be able to change much on the brace height just because of the way they're set up. So now, one of the things you can do if you're always hitting that arm, or we teach a lot of new ones, is, a very new archer, I'll teach them the close stance, but you might be one of those that you have to shoot a little bit more open stance, which means instead of that arm going straight out to the side, it's tilt forward just a little bit. So basically how I tell is line your toes up, put an arrow on your tips of your toes, point to your target. Well, in open stance, you're going to slide that front foot back slightly. Maybe an inch is all it takes, maybe 2 inches, maybe 3 inches. Experiment with that to see what gives you the best position in your form. Uh, and then there's protective gear. While the technical adjustments, adjusting your technique and your equipment, there's always protect. You put an arm guard on. If you have a tendency to hit it more often, put an arm guard on. You just have to watch your String, because if your string is hitting it, you need to have serving where it's going to hit the arm guard. That's why, like on traditional bows, you're going to find a center where you're going to put your nock point, you go up 3 and down 6. The down 6 is because that hits your arm guard. Now, on a compound bow, you only need maybe an inch above, an inch below where you're going to put your nock in there. You don't need all that in there because you're not hitting your arm. Now, if you are hitting your arm, you're going to need to, serve a bit down a little further. Now, here's something else that happens sometimes, not as much. Depend, if you have more of a closed stance, it might happen more. A real long axle bow can happen a little bit more, and that's chest bruising. The chest bruising in archery, is typically a result of the bow making contact with the chest area, during release of the arrow. That can cause, contusions and, discoloration and pain and sometimes swelling. Um, you'll see some of your target archers will have actually a mesh thing that goes over that side, so it slides across that mesh instead of across their chest. Um, so you need to look at that. Ladies, you have a little bit more to think about up there as well. So you want to make sure that when you draw that bow back, that string is at a position where it's not going to scrape across your chest. The shorter axle bows, you really don't have to worry about it because that string is such a short angle, it's not going to scrape across you. If you're shooting a traditional bow or a really long axle bow, that string is not as sharp of an angle. So now it's going to come down a little bit further. So you need to look at that. Overdrawn can be one of those things you're drawing too far back. So, um, you know, basically you're in proper form. We're back to form again. Improper form can cause, those problems. Loose clothing is another thing that we don't really think about too much. But if you're wearing loose clothing, it can catch that loose clothing. And although it may not bother you physically, it's going to affect the way the string is released. Grabs that clothing and maybe it pulls the string right into you and slaps against your chest. There's all kinds of things in there. If you're wearing a necklace, uh, take it off. Don't have anything dangling down in front of you, because if that string catches that necklace or whatever you have on there, it's going to rip it right off. And if it's a pretty tough, band, it's going to yank on your neck. So always tell archers, do not wear any necklaces. Uh, if you do have to have it on, put it underneath your shirt so it's not hanging out. And if it's too short to fit underneath your shirt, it's probably going to be okay anyway, because it's not in the way of the string. Just make sure anything dangles down, whatever side you're shooting from. If you're right-handed, don't have anything in your pockets, in your left pocket. If you're going to do anything, put it in the right pocket, or put it somewhere else. Anything in that pocket can get caught and ripped out. And again, how to recover from it: rest, ice, compression, and elevation. Now, a chest is a little bit harder to elevate it, but you might have to just rest, eliminate what you're doing, recover from it. Ice. It's a little hard to put compression on your chest because you got your chest. You're not going to be able to breathe, get much compression on there. But ice it down if you need to. Um, and there again, you can take, for pain management, take whichever medicine. Ibuprofen is always good. Advil, Tylenol, all those are good. You just got to make sure that that pain medicine is something that you can tolerate. So that's something that you know from your doctor. Um, you know, you can find out from your doctor, what's the case is this, they should know your history. You should know your history and know that you can take this and this. You can't take this. So you just need to know what that is. Um, and if the pain continues, you may physical therapy, or you may have, talk to, the doctor and say, okay, here's what I did. And what can we do? The doctors can help you out with that. Now, preventing it. And we don't want to go through that if we don't have to. Um, you know, One thing, proper tire. We encourage you to wear tight fitting clothes. You know, and other nice tight fitting supportive equipment, that minimizes the risk of contact. So uh, use a chest guard. If you have a problem with that, use a chest guard. That chest guard is a protective layer between you and the string. So it not going to hit you. It's going to slide across to protect, that chest guard. And then, your form, you know, you need to maintain, that proper form that you use so that you can do that. Uh, so understanding these, implement some of these things we talked about, that can minimize the risk of chest bruising. You know, recover involves, proper care, and medical attention. You know, the quicker you get that, the quicker you can return back, to shooting your bow. Here is another thing that we want to talk about, and that's muscle strain. So muscle strain in archery typically affects the upper body, particularly the shoulders, the arms, the back, results in, overstretching or tearing muscle, during the activity, that requires, you know, the activity that requires a required sudden or explosive movement, like drawing the bow, you know, that that is going to cause a muscle strain. And that's why I tell new archers that you need to have the bow weight such that you can slowly draw that bow back. So let's say you're out hunting and that deer is there where they can see any big movement, but you can still draw if you're really slow. So you slowly draw that bow back, and now you're at your full draw and you haven't made any quick sudden movements. That is going to help, muscle strain. Um, what causes it? Overexerting, pulling the string, too much draw weight, that exceeds your strength. One good example of this is, I was shooting 70 pounds and I shot, all summer long and, shooting 3Ds and everything. It's 70 pounds. And it come hunting season here, middle of September. And I quit practicing because now my bow's set up to shoot broadheads, because I only had one bow and I'd have, my broadhead set up, and then when that's done, and I'd reset it up for the summer. So I didn't practice anymore. Well, one morning it's nice and cool out. I'm in my tree stand, and I like to, when I get my tree stand, I got my safety belt on, everything's all ready. I'll nock an arrow, because I normally have a place I can hang it. Well, I'm going to draw my bow back and let down just to make sure, everything is good. Everything is still good. That last check. Well, I couldn't pull my bow back. So I was straining and straining and straining. Well, I overexerted some of my muscles. And now then, I was in pain for a while. So I decided, okay, I'm either going to sit here and maybe be able to draw my bow back later, or just go home. Well, I decided to sit there. Well, after sitting for another hour or so, I tried, okay, I drew my bow back, but I was sore because I overexerted the muscles. Now, the other thing that can cause it is poor technique. Again, back to your shooting form. That can cause uneven muscle loading, increase the risk of that strain. There again, you know, inadequate warm up. That's the thing. I kind of see a little theme here, improper form, um, not warming up, not being smooth. That was one of the things that's going to cause all these problems. Failing to warm up properly, you leave the muscles stiff. That's what I did. It's like I didn't really try to loosen up or anything. I just tried pulling a bow back, and that's what caused it. And now then, fatigue. You know, as you keep using them, muscle endurance, that plays a significant role. When your muscles tire, they lose their ability to, absorb energy and leading to strain. The fatigue, I was building up, I had a good muscle, mass, so I could shoot my bow just fine. In fact, at 70 pounds, I'd shoot a 300 round at 70 pounds. Um, but then I stopped doing it. So basically, as I'm doing this, I'm fatiguing. Now, the other thing you can do is when, in fatigue, you're shooting and shooting and shooting, and maybe you're at a 3D and you've got a lot of hills, you're going up and down hills, constantly up and down hills, and you're wore out by the time you get to the, you've got 40 targets, and by the time you get to number 10, you're worn out. So you're already fatigued, but you've only got 25% done. So that's something you have to look at too, get ready for that. Now, then, how to recover from muscle fatigue. Well, there goes the rice again. Rest, ice, compression, and elevation. That's what you're going to do again. That's how you're going to recover. Just remember that if you have an injury, rest it, ice it, compression, and elevation. That's what's going to, take care of it. Um, there may be, physical therapy might be what you need to do to recover from it. And now let's go back into, from the coach's view, the view I would take is, you want to ensure the archers have correct form. There again, form. Build the muscles. You want to handle the stress of drawing the bow. So if you know you're going to go to a tournament where you're going to shoot 60 arrows one day, 60 arrows the next day, and it's a 3-day tournament, 60 arrows the next day, by the time you get done to that third day, you might be really worn out. So to prepare for it, maybe what you need to do is you need to start shooting 60 arrows a day, 3 days in a row. Might be a little bit tougher, if you're working on a Friday, but get off work Friday night and shoot 60 arrows Friday, 60 arrows Friday or Sunday or Saturday morning, 60 arrows Sunday morning, because a lot of tournaments you're only going to be morning or whatever. And then once you get in that whistle, well, maybe you need to shoot instead of 60 arrows, you need to shoot an extra 10 arrows. So then by the time you get to that third day, or even if you might have different tournaments where you might shoot 60 arrows on Friday, and in a tournament you're going to shoot 60 arrows in the morning, and then you got 60 arrows at night. So look and see what the tournament is doing, what you're going to have to do, and prepare for that. That's one of the things that you want to do is try and go through and get that strength built up where you can handle it. Come up with a warm-up routine. We've talked about this, it's third time now, or just every time we talk about a pain or an injury, you need to warm up. So come up with a routine that works best for you, and then go through and do that before you shoot. Um, and then the other thing is, the bow, is it the proper draw weight and the proper draw length? That is going to be the biggest thing. And then, rest periods during your practice, to prevent the fatigue. How much time are you going to need to do to recover? That's why if you're shooting 5 spots, you shoot 5 arrows. You wait for everybody done shooting 5 arrows. You go pull your arrows. You come back. You have time between that you're not shooting, and then you shoot 5 more arrows. And then same thing there. So when you're practicing, if you're shooting a 5 spot, or if you're shooting a 3 spot, you're going to shoot 3 arrows, and then you're going to go pull them and shoot 3 arrows. You shooting by yourself, you're going to shoot a lot quicker than you would at a tournament. So you may need to shoot those arrows, pull those arrows, and as you're writing down your score, log what your scores are and tell how you felt for each one, and then that'll kind of take care of the extra time in there. By understanding all these things we kind of talked about here, on this subject, that's going to help you return quicker to shooting. In a little conclusion here, as we draw this session to a close, remember that archery, like any sport, carries a risk of injury. But with the right knowledge, preparation, and respect for the craft, these risks can be minimized. Whether you're dealing with string slap, archer's elbow, or muscle strain, or shoulder problems, the path recovery is clear. Proper care is rest and gradual return to form, to that proper form, and prevention. This is all about the techniques, training, and listen to your body. So take these lessons we've talked about here so far and apply them to your practice, and always aim for safety as much as you can aim for the bullseye. Until our next session, keep your arrows flying straight and your spirits high. This is Ray Canterbury. I've been your host today on Archery 101, and your coach for this session. So shoot safely, everyone, and stay tuned. So the next one, the next podcast would be the next lesson will be on, what to look for and how to care for your equipment, whether it's a longbow, recurve, compound, or crossbow. There's some things that you need to look at, to check on your equipment. We're going to cover that in the next lesson. So stay tuned for that. Thanks for tuning in to Archtalk 101 podcast. Don't forget to join the Archtalk 101 Facebook group if you have not already. There you're going to see live podcasts as well as replays, expert advice. Replays are also available on my YouTube channel, Learn to Fix Yourself, and at archtalk101.com. And those that prefer to listen, you can listen on Spotify as well as audible.com. And I will put links to the articles that I used for reference in here. Now, like I said, there's about 30, 35 different articles that I was able to reference and pull information from. So you're more welcome to look at those, get more detail. And if you have any more questions, just let me know, and we'll cover those as we need to. And so for right now, we're going to call this one over, and make sure you follow us, and we'll answer any questions you happen to have.